there's a proposal to have some sort of a separation between vaccinated and unvaccinated people in business establishments.
Yeah, maybe let's take it in the right context now. We have been meeting with Octa Research and Dr. Ed Salvania, the private sector, trying to align basically the exit strategy out of this pandemic. No?
Mm-hmm.
And uh, what's very important are milestones. No, when our seniors would be at least 50% vaccinated, when would we hit population protection, which according to Octad is defined as 40 to 50% of an area, in this case NCR plus, and when would we hit herd immunity, which is at 70% of
Mm-hmm.
basically NCR plus. Now, in all of these, assuming we do hit certain milestones, how do we open up the economy safely? I think that's very important. Now, as we open the economy, because more people will be vaccinated. So the key point here is the number of people being vaccinated. So that determines how much you can open your economy. The less number of people that are
Certainly.
vaccinated, of course, you can. Now, the idea is to protect both sides. No, we understand that there will be some people who will not want to take the vaccine, and there will be people that will be taking vaccine. So how do you protect those vaccinated from getting infected from the those not vaccinated, and vice versa? The proposal is to put safe places for them. No, we've seen it in other countries. It's not we're not reinventing anything. In big arenas like what's happening in the NBA games, they put a section for the vaccinated and a section for the non-vaccinated. Moving forward in restaurants, there is a request by restaurant.ph that the current capacity of 30%, which is already allowed, plus 10% if you have
Mm-hmm.
the safety seal,
Mm-hmm.
the request is if they can add additional 20%, but the people that they will add are fully vaccinated. After consulting with Secretary Maynard Guevara, that is not allowed to disallow any non-vaccinated people in any premise, and I agree with that. No, this is not the objective to disallow the non-vaccinated. The idea of this is to protect both sides from getting infected.
Would it be correct to say that what you're looking at is uh, maybe perhaps putting up a premium premium space, you might call it that, for those who are vaccinated, not necessarily to prohibit non-vaccinated people from entering an establishment, but putting aside a special place for those who are.
No, for example, that's the intention. There is no special place now in smoking and non-smoking areas. There's no special place. They just put the smokers in one area. I mean, there are many ideas here. No, for example, the non-vaccinated can be more outdoor than indoor. You know, if there
Mhm.
is. No, ang sinasabi namin is like maybe the best parallel to this is in wherever applicable. No, wherever applicable. That's number one. No, number two. I think this is not a mandatory thing that I believe that IACTF should impose. No, uh, but maybe to me the best example is in just what we see in the NBA games. No,
Yes, sir.
there's a certain section. So that's the in movie theaters you don't maybe do it in a movie theater you do it by time. No, let's say this
Mhm.
time this the fully vaccinated will be at this time, and the rest of the time it can be mixed. No. So those who want to be extra protected both ways, then they have a different time to watch the movie. So these are just ideas that we're discussing at this point in time. I mean, their ideas have to flow in so that we can do the best, no, as we open the economy and make sure that both sides, the vaccinated and the non-vaccinated, are kept safe. No? The establishment will have to determine that. You know, if there is no way to do it, and it's up to him to look at the risk level. No, if he feels that the risk level is low. So this is really part of the planning process, which I call the next normal. No, this is not
Yes, sir.
here to discriminate non-vax
Yes, sir.
and
Well,
vax. No,
certainly.
that's
Yes.
not the point. Yeah.
Well, I was asking if this needs a special law to be passed by Congress, or can this be done administratively?
First of all, uh, denying entry for non-vax is not allowed. That's very clear. But
Mm.
for uh, what they call separating non-vac to vac, depending on the practicality of it, is allowed, provided what he said is we cannot deny entry. And I agree with him. Nobody is
Yeah.
going to deny entry of non-vaccinated.
Well, sir, I asked about whether or not you would need a law because it would certainly help the private sector if there is a cover law that puts this into place. Secondly, that also helps the private sector in avoiding accusations of discrimination. I mean, like it or not, there are some people who might raise that issue of discrimination if they're not allowed to go to certain sections at a certain time of the day. I mean, like it or not, that sometimes really happens. So it might really help you if there is a cover law or a cover ordinance. For example, the rule on smoking and non-smoking sections that's covered by ordinances, and that helps establishments to enforce that.
Yes, it depends on the LGU as well, no? I believe it's, but according to him, and I'm just sharing with you that what is not allowed is denial of entry of non-vaccinated in any establishment. So that's, of course, a private home is a private home. No? You can deny entry. That's your home. No, or so. I mean, what is not allowed is to deny entry of non-vaccinated, and that's not the intention after all. Because what we want to do, and especially all of these establishments, is to encourage entry of both. No, but ensure that there is adequate protection for both sides. So that's the intention. And according to him, that is allowed, and that is within the legal framework. So there is no need to put a law that protects both non-vac and vac from infecting one another. So there is
Mm.
no uh, plan to deny both, no entry. The idea is how do we help create, that there is adequate protection for both sides, and wherever applicable. And of course, if the LGU mandates it, it they can do so. I was saying that this can be all voluntary on the part of the private sector, but within a certain framework.
Are you saying, sir, that owners can put this into place right now? I mean, is that the idea that since you're saying that there is no need for any law, then that this could be put into place um, by certain establishments if they have the space already?
Yes, it is not prohibited to create a safe work, either a safe working environment or a safe place for people to ensure that when they go to, whether it's a restaurant or whatever is allowed now, no, movies are not allowed, and watching of games like basketball is not allowed. So uh, whenever it's allowed, then the owners can look into how they can open up, or they can propose to the idea if they can open the theaters under these following conditions. No? What people can do is, if they don't have enough indoor space and they have outdoor, then they can very well allow those non-vaccinated to be outdoor because it will be safer for them. No, and those that are vaccinated can opt to be anywhere. No, they can opt to be outdoor or indoor. No, so that's these are ideas. No, I mean, I don't own a restaurant, so I can't really say what is best. And I think the restaurant owners would know how to handle this situation. Even if you haven't taken the vaccine, you cannot be denied entry. We cannot keep the economy closed forever. No, it's going to be difficult. But the key to all of what we're going to do is we need to vaccinate the people. Now, it will take time, but now as the vaccines start arriving with the 40 million doses of Pfizer, all of these things will allow us greater. Uh, People will have more access to vaccines, and as you will be able to hit population protection sooner, no? And even if we don't hit herd immunity, population protection alone is adequate, no, to open up the economy already. And some people will say it's discriminatory. I don't believe it's discriminatory because this is a public safety concern, and this is we're in a pandemic. This is not a simple dengue, you know what I mean, or
Yes, sir. Yes, sir.
virus out there. This is you can see the magnitude of death that is happening out there. So
Yeah.
I think I think the acceptance level of people wanting to be vaccinated is going higher. As the supply comes in, it will be higher. If we are able to be lucky to hit herd immunity by the end of the year, then there's no need even to have these restrictions.